District to order. I'm Mayor Ken Tedford. If you would all stand and pledge allegiance to the flag.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Could you take roll, please?
Okay, roll call. Chairman Tedford.
Here.
Pete Olson, I believe he's not here. Shannon Ernst.
Present.
Justin Heath.
Present.
Bob Erickson. Denise Ferguson.
Present.
Tyson McBride.
Present.
Larry Rackley.
Here.
Jeb Rowley.
Present.
Rick McKay.
Do you have quorum present?
Yes, I believe we have 3 present and 3 online, so 6 total, which would give us a quorum.
Okay, thank you. Item 4 is for public comment, general in nature and not relative to any item on the agenda today. Discussion can be held, but a decision can. Is there any public comment? Mr. Clifford? There you go.
Oh, trying to move it around and it's going on and off. Okay, good afternoon, Mr. Chairman and District Board members. For the record, I'm Bob Clifford from Fallon. Over the last, what are now 3 months, because I was here, but the snow shut everything down on the last meeting. Information continues to come out about the COVID mRNA experimental gene therapy, also known as vaccines. And what I brought today is what I submitted a month ago, so it's basically a month out of date. And the amount of information coming out is enormous. I think we now know that these treatments do not prevent infection, do not prevent transmission, and we know that Pfizer held 38 deaths, critical information from the FDA before it went for emergency use authorization, and if that data had been known, it would not have been approved for emergency use authorization. Pfizer lied. So a lot of knowledgeable experts in that you know, the several pages of articles with links to the articles and a little bit of a short summary, they're saying the worst is yet to come and that we're going to see a tsunami of deaths this year on the order of 30% of those that were vaccinated, which would be a catastrophe. I think you'd agree. I hope these guys are all wrong. But, you know, the turbo cancers, the heart problems, I mean, excess deaths are already running 10% above where they were historically, and, you know, we're talking about it going up to like 30. So I asked, are we still in an emergency? Why are we operating under an emergency use authorization when it doesn't appear to be any emergency anymore? And, are the benefits really outweigh the risks on these vaccines? And why is the government continuing to hide data while at the same time pushing and recommending that people take more shots? None of this makes any sense. And it's pretty common information that groups like the World Economic Forum, which is headed by a guy named Klaus Schwab, guy looks like Darth Vader. I mean, and they have numerous members of the World Economic Forum throughout the federal government. And they boast that they've infiltrated the boards and the, especially the Western governments around the world. These guys want a massive population reduction. Well, how do you get a massive population reduction? Billions of people. There aren't a lot of ways to do that, but if you can give everybody in the world a shot, that gives you a good shot at it. So, and this Klaus guy has called to criminalize any mention of a tsunami of deaths. He doesn't want anybody talking about that, which is, this whole thing is scary. And Bill Gates and, others are on this same depopulation agenda. They're trying to save the planet. And it's questionable whether the whole argument makes any sense at all. Anyway, the other thing I'd like to bring up is, the Federation of State Medical Boards issued a warning to physicians not to deviate from the official narrative. And state medical boards will pull medical licenses and take other various drastic actions against physicians. So you really need to question, when a doctor's livelihood, his license is at risk, can you trust them to ever say the truth and go against what the official narrative is? If I was going to lose my livelihood, I'd probably go with the official narrative. That's the problem in this thing. They're trying to control everything. So you need to do your own homework. You can't rely on people that are controlled by the establishment. So, the mainstream media is silent, dead silent on all of this. They won't talk about excess deaths. They won't talk about the new research that's coming out. And more of the research is explaining the cause and effect, why the excess deaths are up. And I haven't had, when I come back next time, I'll have all those studies and things that support that. But without informed consent, we shouldn't be given these shots. People don't understand the risks. They don't understand what they're getting into. And I think you'll find that list of articles, if you actually even just go read through my little, short summaries, you'll find them alarming. This whole thing is scary. And as a side note, if you're worried about yourself or your family, there are things that natural remedies that can be taken that'll, mitigate the side effects. Things like nattokinase that'll destroy the spike proteins in your body and that type of thing. So, contact me if you're if you're worried and you'd like. Because all my friends, family, and kids are taking all this stuff, and so far so good. So, anyway, thank you very much for your time. Appreciate it.
Thank you, Bob. Okay, we'll go to item 5, the verification of posting of the agenda in compliance with NRS.
Julianne Ikonen, for the record, the agenda was posted on the second day of February between the hours of 3 and 5 p.m. at the locations listed on the agenda in accordance with statutes.
Okay, thank you. Considering this agenda, need approval of the agenda as submitted or revised. Do I have a motion?
Shannon Ernst, for the record, I'll make a motion to approve the agenda as submitted.
Do we have a second?
Larry Rackley, for the record, I'll second that.
All in favor, signify by saying aye.
Aye.
Aye. Aye.
Any opposed? Being none opposed, the motion carries and the agenda has been approved. We'll go to item 7, Consideration of approval of the minutes of December 14th, 2023. Motion?
Larry Rackley, for the record, I'll make a motion to approve the minutes of the meeting held on December 14th, 2023.
We have a motion to approve those minutes. Do we have a second?
This is Shannon Ernst. I'll make second.
We have a motion, a second. All in favor?
Aye. Aye.
None opposed? Motion carries, and the minutes of December 14th, 2023 have been approved. Item 8A, appointments, consideration and possible action concerning ratification of the Central Nevada Health District Administrator's appointment of Kathleen Patterson as the Deputy Health Officer for the period of December 17th to December 27th, while Dr. Ted McDonald was unavailable. Darren?
Mr. Chairman, members of the board, thank you. Yeah, this is to ratify the appointment of Kathleen Patterson as a Deputy Health Officer when Dr. McDonald was on vacation from December 17th through December 27th, just bringing this back to the board for that ratification.
Any discussion of that from the board? If not, I'll entertain a motion to approve that.
Shannon Ernst, for the record, I'll make the motion to adopt the adoption of resolution, I can't speak now, CNHD-01-
Shannon, if I may, I think you're on item B,
Oh, what
whereas we're on
Thank you. I
item A
wanted to
for the motion.
skip. So
can keep
I am
going if
going
you want,
to
I
make
just-
a motion for the ratification of the Central Nevada Health District Administrator's appointment of Kathleen Patterson as the Deputy Health Officer for the period of December 7th to December 27th, while Dr. Ted McDonald was unavailable.
Do we have a second to that motion?
This is Denise Ferguson. I'll make second.
We have a motion, a second. All in favor?
Aye.
Aye.
None opposed? Okay, we'll go to item that has been approved. We'll go to item 8B, consideration and possible action concerning adoption of resolution CNHD-01-2024, a resolution appointing the Central Nevada Health District Family Nurse Practitioner as the Central Nevada Health District Deputy Health Officer. Darren?
Mr. Chairman, members of the board, this follows kind of agenda item A or 8A. There are going to be times when our district health officer, Dr. McDonald, is going to be out for various reasons. And so we would like to make sure that we have some continuity and have a deputy health officer available when needed. And so the position of our district family nurse practitioner meets those statutory requirements relating to kind of health officers' graduate education in public health, training and experience in public health programs. So this resolution appoints the district nurse practitioner to serve as a Central Nevada Health District Deputy Health Officer when our health officer is unavailable.
You all remember this is something that I recommended at the meeting in December, I think. And Jim asked to be put on an agenda, so that's why it's here now. So I'd be willing to answer any questions as well as Darren on this. Are there any? If not, I'd be willing to entertain a motion.
Larry Rackley, for the record, I'll make a motion for the adoption of resolution CNHD-01-2024, a resolution appointing the Central Nevada Health District Family Nurse Practitioner as the Central Nevada Health District Deputy Health Officer.
Do we have a second?
This is Tyson McBride for the record. I second.
We have a motion, a second. All in favor?
Aye.
Aye.
None opposed? Motion carries, and that resolution has been adopted. We'll go to item 8C, consideration and possible action concerning appointment of the following individuals to the Food Protection Hearing and Advisory Board. Corey Ager, 1-year term. Julianne Hanson, 1-year term. Kristen Kruger, 1-year term. Steve Russell, 2-year term. Gina De Valera, 2-year term. John Hanson, 2-year term. And Bill Ferguson, 3-year term. Darren?
Mr. Chairman, members of the board, for the record, Darren Winkleman. I am going to turn this over, Mr. Chair, if it's okay with you, to Maria Menjivar. She is our environmental health manager, so she will be working directly with this new advisory board. So Maria, I'll turn it over to you.
Okay, thank you.
Mr. Chairman, members of the board, Maria Menjivar for the record. You have before you the selected chosen members for the advisory board for the selected terms. For review, and with your approval, we'd like to move forward with appointing these members representing the district from the different and diverse jurisdictions. And I'm happy to answer any questions if you have them. Thank you.
Any questions from the board? Being none, I'd entertain a motion to approve these individuals to this Food Protection Hearing and Advisory Board.
This is Shannon. I'll make a motion to approve the following individuals to the Food Protection Hearing and Advisory Board. Corey Ager, 1-year term. Julianne Henson, 1-year term. Kristen Kruger, 1-year term. Steve Russell, 2-year term. Gina De Valera, 2-year term. John Hanson, 2-year term. And Bill Ferguson, 3-year term.
We have a motion. Is there a second?
For the record, Larry Rackley, I'll second that motion.
We have a second. All in favor?
Aye.
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 None opposed? Motion carried, and those following individuals had been approved to that Food Protection and Advisory Board. Okay, we'll go to item 9A, presentation update of the Central Nevada Health District budget for FY24. Darren.
Mr. Chairman, members of the board, for the record, Darren Winkleman, thank you. This is an informational item just to kind of give you an update on the budget. I believe we've been at this for, I don't know, I can't keep track anymore, 7, 8 months now or whatever we are at. But I think you have a new document. It's a little bit updated in front of you that was from your original packet. Just really the only update is that it's the numbers are updated. Pretty much everything else stayed the same, except for a little bit of cleanup in the document. But overall, in the columns on the left, I think the most important ones there are column 2 and 3, the projected 24 expenditures and the projected grant revenue. And then in column 5, which is our actual expenditures to date. Everything, I believe, looks really good. I'd like to thank Shannon Ernst for her and putting this all together for FY24. Hopefully we did some justice by cleaning that up and presenting it in a way that's readable. But overall, I think based on the grant revenue that we project, just shy of $3 million, and expenditures a little over just call 2.3 million. So I think overall we are looking really, really good in our grants. The task for us on these grants is to go back and collect money for those grants. So as you know, some of the grants that we have were not executed till well into our startup, and so now it's our job to go back and make sure we're retroactively back to July 1 to pick up those dollars. And so we're actively doing that now. We'll be doing a big push here this month to go back and collect, and our state partners have been really working well with us and working well with them to be able to go back and collect that revenue retroactively, and so we're in pretty good shape. The columns on the far right are basically the grants that we have that we hope to collect on as we go through, and you'll see later on, those grants are continuing into next year of FY '25. But again, overall, we did a great job, I think, in going after those grants, getting them executed. Columns in the middle are projected, what we were basically calling general fund revenue, our member funding, along with some of the clinic fees that go along with that. To be honest, it looks a little low on the clinic fees as well as a little low on the EH fees. We think those are going to go higher, but didn't have a clear picture. We noticed that on the EH fees, some of the EH fees were paid to the state before being paid to us, and I didn't feel it was appropriate for us to go back and double collect on those individuals that paid to the state. So there's going to be a little reduced revenue for a little bit in this fiscal year because of that. Clinic fees, we just didn't know what to expect. We have some numbers from our state partners, but again, we're unclear really to give a solid number. Also, we are still waiting on some Medicaid, Medicare billing things to help us collect some of that revenue. So a little bit low on those. I think those are going to go much, much higher as we move into next year, FY '25. So I think with that, Mr. Chairman, I can turn it back to see if there are any questions on this particular budget.
Any questions of the board for Darren?
This is Shannon for the record, and it's really not a question. It's a conversation you and I have had, Darren, about the EH fees. And I urge you to really push on environmental health. The agreement when this transpired was that those fees they collected before July 1 for services after July 1, that was to be transferred to the health district. So I would like to see them hold true to that because they did collect a lot prior. And that was an agreement because it was too hard for them to prorate it when they paid. So they said, no big deal, they can actually go back and they can do that and then do that transfer. So I would just urge you to keep on that with them.
I will do that. Thank you. Yeah. That
Is
would be
that
helpful.
Shannon, is that in excess of that 50,000 or just that 50,000?
So we did not have a projection on what would be transferred from the state, so that would be in addition to that. At the time when these negotiations happened, it was kind of, they didn't know. And so they were going to run a report after July 1 to be able to show what was the fees collected from that time period that were going to be used for after the time period. Does that make sense, Mr. Chair?
Mr. Chairman, if I may add to that as well, we know based on our database, for the most part, all of the facilities we have, they're being charged a fee. The unfortunate part is we're not sure that database is complete yet. There were transfers again from the state to our database that not quite make it clean, for lack of a better way, and we're in that process now of cleaning all that up. So again, we just wanted to kind of keep that a little bit lower just so we didn't overshoot the budget there.
Darren, will you send those updated numbers to, email this, copy of this to the board
Absolutely,
that has these updated numbers
absolutely.
that aren't in the agenda packet?
Yeah, most of the numbers you'll see there are updated are the ones on the column number 5, year-to-date actual expenditures. The packet, which the summary you had in your packet, I think was just shy of $1 million, and so that's updated there. And I think
But it
updated
changes-
revenue as well.
It changes a couple of your columns. Your second column changes,
Yeah,
your
Yep.
third column changes.
yeah, the projected grant revenue changed as well as
Your
actual
11th
expenditure.
column changes.
Yeah, so
Your
yeah, we'll get it out. So thank you.
7th column changes. Just send a fresh copy.
Absolutely.
Okay, thank you. Let's move on to 10A then. Consideration and possible action approval of the Central Nevada Health District's tentative budget for fiscal year beginning July 1st, 2024 and ending on June 30th, 2025, as submitted, revised, and request that the Churchill County Comptroller provide the necessary documents to the Board of County Commissioners and to the Department of Taxation as required by Chapter 354 of NRS. Okay, Darren, you're up again.
Mr. Chairman, members of the board, for the record, Darren Winkleman, thank you. So this is an action to approve our FY24, FY25 budget as submitted. This budget invests in all the residents and visitors to our region. I believe it addresses our critical challenges and opportunities we face as a rural public health entity, including tackling the ongoing COVID-19 challenges, expanding access to public health services, addressing health disparities, and strengthening behavioral health and promoting the well-being of our children, families, and seniors. This budget is a $4 million budget for FY25, and I think it demonstrates the district's commitment to investing in public health and ensuring our programs serve the people, the communities we serve. We can go in, I think you may have a document in front of you. If we can pull up that pie chart, just real quick. Do you have that pie chart? Maybe. If we don't have it, that's okay. Basically, our most of what you see in this particular budget, as most entities of this nature are, the biggest percentage is salaries, and along with that, our benefits are kind of the biggest chunk of this particular budget. We have a pretty large operating and our contractual services as well for this particular budget, and the remaining portions of the budget are in equipment and services and supplies, and are in state and out-of-state travel training. So if you look at, again, the anticipated grants that we have for this particular budget are pretty much similar to what we had prior to or in this current fiscal year, FY24. Conversations with the state are telling us that those budgets are going to, or grants will probably remain flat in terms of what we saw in '24. They're going to remain the same. Again, we hope to not only, try to get more out of those grants, we are going to also be looking for their opportunity as well. But again, the grants are looking this year at a roughly about a little over almost $3.2 million for us, which is really good. And again, we've been working pretty close with the state, our state partners, with those grants. Also, what you're seeing on the screen now is this summary of expenditures, what we're kind of looking for in terms of what we would more or less classify kind of as increases in our general fund, and above and beyond what we've kind of had before. It also shows, again, some of those grants, but, looking a little bit more into our operating utilities and electric, we feel that's, the budget last year was zero. We know that going into a potential new building, we're going to look at increases in those, in that particular line item. So we built some money into that, as well as, again, part of that utilities is the gas, utilities and gas. So really kind of looking at next year, an additional call it $70,656 to cover in our, from our general fund. If you look at our expense and revenue sheets that should be in front of you, they, again, were showing in our revenue about 3.9 million total. That includes all of our general fund. Do you guys have that sheet up, those sheets by chance? The big one? Yeah, the two big ones, expense revenue sheets. Sure everybody's seeing those? Yep. No, that's a summary. Do you have a? They were in the packet, so. Yep, there you go. So that's our expense. That's our expense report. That's really the biggest one, the money, the dollars that we're spending. So we can go back up to that one. So we're looking at you can see all of the different accounts and different grants that we have in that expense budget, and where we believe those expenses are going to come out of, for a total of about $3.9 million at the end of the day. Again, based on the revenue side of that as well, we believe we're going to collect $3.9 million. So again, we're looking pretty good. Grants are always an unknown, as we all know, but we feel pretty confident that those grants are going to come to fruition and to fund the things, the services we provide. So with that, I will turn it over, Mr. Chairman, to you to see if there are any questions or if I can clarify anything.
Does the board have any questions?
I will add, Mr. Chairman, if I may, for the record, Darren Winkleman, there is a pretty hefty capital outlay in this budget going into FY '25, just due to the fact that we're hopefully looking at Shannon, hopefully get a nod, going into a new building. And so we just wanted to make sure we had enough money to make sure that we could outfit that new building with the proper data, but mostly data needs, running new wires, phone systems, everything for our computer needs that can run our databases. So that's where we see some of the large capital outlay.
Mr. Chair, this is Shannon. I had a question. Do we have the projections of what the costs are going to be to each of the members for 2025? I know both of us are scrolling, trying to find that in there. Do you have that broke down on what those contributions would be?
I'm on the revenue page. I don't see it.
My tabs things
We-
not working today.
Mr. Chairman, members of the board, for the record, Darren Winkleman, we do have, that's on the budget summary from last time, but we are working on that diligently. I worked with Mr. Rackley to get his number squared away because we had some discrepancies there. And so I think we've got everything now square, so we'll be sending that out either, my guess is probably tomorrow, to all the comptrollers in the city of Fallon, and to have those data points updated.
Even after me.
So I bet, yeah.
that number?
Where's the number? Yeah.
Well, you said you had 3.9 in revenue, right?
So the revenue, right now, we're looking at revenue at about 3.9 million.
3.914883.
Yeah.
I mean, that's, I have not been, I had an illness, so I haven't been around, so that's the only page I could find, but I didn't run this page by my clerk treasurer, but on that page, I didn't see member fees. I saw the 3.9 million, and I didn't see where.
Yeah, so on that particular sheet, Mr. Chairman, for the record, Darren Winkleman, if you look at the second line from the bottom, it's called admin assessment facility fees.
That's a member fee?
That's the member fee there, correct?
That stands to reason. That matches that number on your last agenda item for member fee. Yeah, I apologize. Because if you go back to your last agenda item on 9A, that matches your member fee total for projected in the middle, in your middle columns.
Question, this
Is
is
that-
Jeb Rowley, Eureka.
Go ahead. Go ahead.
When these dues are payable, what's the date?
Jeb, can you repeat that? I didn't quite hear the question,
When are
sorry.
those member fees payable?
They are payable, most of them, I think, turn to Rita a little bit quarterly right now. Everybody's doing them on a quarter basis throughout the year.
Starting in July 1.
Starting July 1, correct, yeah.
Starting July 1. And you say you were sending that out to your comptrollers, but I don't, and maybe you're sending them out to the jurisdiction comptrollers too, or do the membership for those jurisdictions get those?
Both, for the record, Darren Winkle, both will get it. Members will get it as well as the comptrollers for each county.
And that'll be in the next few days.
Yes, hopefully by tomorrow, yeah, if we can, yeah.
Well, you're projecting a 703,000, and last year you only got 511,000, is that right?
So that, Mr. Chairman, for the record, Darren Winkleman, that should be, 703 should be what we predicted for FY '24 as well as FY '25. That's 703,000 for both.
So is the 511,000 what you've got through December 31st?
Yeah, so so far, we've collected just shy of $600,000 of that member funding up to date.
You have 2 quarters left,
I'm sorry.
through March and through July. Is that what you're figuring is your other 200,000?
Yep.
But, Mr. Chair, I think if I'm correct, a couple of counties paid 100%, correct? So the city of Fallon had paid 100%, Churchill County, no? Churchill County did, city of Fallon,
I don't
they
think.
have, they didn't pay for last year yet? Okay. Okay. So that's why that number would throw not exact 50% of paid. And then I just want to confirm that the $200,000 that was set aside for the contingency account, that has not been expended, correct? And so that should hit 200,000 June 30th
For the
with
record.
everyone's payments.
Mr. Chairman, for the record, Darren Winkleman, you are correct. That it has not been expended. We still have a little bit of billing to do to collect up to that 200,000. So we're finishing up with that. And then FY '25, that will, be gone. So for
Thank
FY
you.
'25, no contingency funding for that for next year. Yeah, again, hopefully being fiscally responsible, we don't want to touch it if we can help it. So.
No, and that's a great job, but I just wanted to make sure that I had that clear as we went through, because I know we had that discussion and everyone aware that those are 2 separate accounts, so that would not show on here if they were trying to add up what theirs was and so on.
I have a question, Chair. This is Denise Ferguson. For the record, I just wanted to ask Darren about just in the budget if there was additional expenses identified for Burning Man.
Mr. Chairman, members of the board, for the record, Darren Winkleman. Yes, we did build in funding for Burning Man. The biggest piece of Burning Man, to be honest, which sounds a little crazy, but it is the rental of a place to stay. To be honest, we rented an RV so that staff had a place to kind of hold up during the event. So, yeah, we did factor that in. Thank you.
Thank you.
Okay, any more questions on the budget? I think you've done a really good job so far.
Thank you, Mr. Chairman.
If there's no more questions, I'd entertain a motion to approve this budget.
For For the record, Shannon Ernst, I make the motion to approve approval of the Central Nevada Health District's tentative budget for the fiscal year beginning July 1, 2024, and ending June 30th, 2025, as submitted, and requests that the Churchill County Comptrollers provide the necessary documentation to the Board of County Commissioners and to the Department of Taxation as required by Chapter 354 of the Nevada Revised Statute.
Okay, we have a motion. Do we have a second?
For the record, Larry Rackley, I'll second that motion.
We have a motion and a second. All in favor?
Aye.
Aye.
None opposed?
Aye.
Thank you. None opposed? Motion carries, and the Central Nevada Health District budget for FY 24-25 has been passed. There is the caveat to go after the state for that funding that Shannon mentioned from, that's not part of the motion. Okay, we'll go to agenda item 11A. Dr. McDonald's health officer update. Dr. McDonald?
Thank you, Mr. Chairman. This is Ted McDonald for the record. In your packets, I presented an overview of the clinical services, community activities, vaccinations, and some attachments. We have clinically, things are organized now where we have regular schedules in most of the communities. We are providing vaccines, we're providing services. One of the interesting things that Darren and I have done is we've had a chance to visit half of our constituents right now and have worked with Mineral County and with Eureka to determine what sort of clinical services and services in general they need. We have a meeting tomorrow with Mr. Rackley and Tyson McBride to discuss those activities in Pershing County. What has been interesting is the clinical needs kind of match the population. Mineral County has excellent services. They have a capacity to do a lot of the primary medicine. And we're looking at, because of that, that the clinical portion of the health district can be a catch basin or an ancillary help to the community in their activities that we can specialize in, like vaccinations or some of the STD evaluations. We found the same with Eureka County. They have excellent clinic and services in that area, so we are going to be an aid to them. We've been invited to some of their health fairs. In fact, our worker out there in Eureka is helping to organize a community service day in April or May on there. So that has been good. There's some areas where we can help in, but there's not a lot of volume, such as Crescent Valley. They are really anxious to have our services. And also tomorrow we'll find out more from Pershing County how we can help with them clinically. What this does is by assessing this, it allows us to look at what is necessary for the larger counties so that we can provide clinical services in a balance with the services they pay for. And that's what it's beginning to look like, is that there will be a pretty even distribution on clinical services depending on your population base. So that's been helpful in our process. I won't go too much more into depth, the other stuff. The handouts that have been presented to you, these come from our epidemiologist, Victoria Spesic. And these are examples of, first, if you look at the influenza and influenza-like illnesses, this is what is on our website. This is what we're presenting, not in quite so much detail, but so that someone can look at this and see what's going on in their community, and it's specific to their communities and broken down. This can be even more refined if you wanted to start looking at displaying what age groups are involved. Victoria has placed in here, in her key messages, a breakdown of that, who's been most affected, and it's very young people and older population that have been affected this year, and also presenting kind of a comparison to what's going on in the state and the nation. The second one is something called syndromic surveillance. We have, as of the beginning of February, taken on the reporting capacity for reportable diseases. And the team is meeting with Banner Medical at the end of this month so that Banner Medical knows what the reporting looks like, who the contacts are. Part of our trips to the outer counties is also connecting with them and finding out who wants this information and who are the contact points. So if the clinics in Pershing County want to know what is our suicide rate, or what's the syphilis rate, what's the, any sort of rate that we collect information on, we can provide that to the right people that want that information. This here, the example I provided, we're looking at suicide, drug overdose, and opioid deaths. And there are just a myriad of different opportunities to go in there, and this can be specific to an organization that wants to know what's going on. I wouldn't propose necessarily that we put so much information on the website at this point that people are lost in it. But this is an example of what we can do and how specific it can be. And when an organization like a community organization that's focusing on opioid deaths wants to be able to know what's going on, and they have programs or asking for grants, they can use this information to apply for grants, and also as they move along with their program, it gives them a milestone of measurements to say, our program was successful. So I apologize for going a little bit long, but are there any questions?
No, that's real good data.
Yes, and Ted McDonald for the record, and Chairman Tedford, I appreciate a couple meetings ago the direction that you provided for having this available. It was very, very helpful to know that this is what people want to see, and that we had the support of the board to present this.
No, this is real good.
And again, Victoria Spesic is the wizard that put this together. And what I will probably wind up doing in the future is, as we have these meetings, have her do this presentation as she is available.
Okay, thank you.
You're welcome.
Any questions? Okay, if not, we'll go to agenda item 12, the administrator report.
Mr. Chairman, members of the board, for the record, Darren Winkleman, I figure you heard enough of me today in terms of the budget and where we are with our numbers, so nothing new really to report on the administrator side. Again, we've been working diligently over the last month to make sure that we brought you a clean budget, and that we were comfortable in you knowing that we're moving quickly and fast on this particular budget. So that's really our updates for now. I will always say too, for the record, that couldn't do it without the people, two of them behind me right now, with the support that they give, and then the remaining members that we have, the team has just been incredible keeping things moving while we're stuck in our offices working on numbers. So I really appreciate everybody's support in the district and the board support as we kind of move forward and finally get our feet up underneath us a little bit. So overall, I think things are going well. We're hearing good feedback from people, which is super good throughout the community, and I think things are just going to get better. So again, thank you for support. That's all we got.
Okay, thank you. Any board member updates?
For the record, Mr. Chair, I just wanted to provide you an update that it looks like we'll be making a recommendation to the Churchill County Board of Commissioners on February 21st for my replacement on this board. As you know, it was the goal when we started over a year ago that Jim and I would be on here. Jim has been replaced, and now we'll be looking for a replacement for myself. So you may have a new member come March.
Okay, well, we'll miss you. Thank you for all your hard work. Appreciate it. Any future agenda items? Okay, we'll go to item 14, future meeting date will be the second Thursday at 1:30 in March. I'm not sure what date that is, but it's the second Thursday at 1:30 in here, or I'll try to do better on the virtual with all you folks that are outside Fallon.
Mr. Chairman, if I may, for the record, Darren Winkleman, that I believe will be March 8th, which is no, is that right? March 14th, March 14th.
14.
I think is what I'm looking at. Is that right? Am I looking at that right? So March 14th. Mr. Mayor, if I may too, there was been some confusion with somehow Dr. McDonald got on the meeting organizer, and I asked him yesterday morning to cancel that. That threw kind of a kink in the works. And so you will be seeing a brand-new invite, creating a new Zoom meeting invite for that. So look for that in your email box.
What were we canceling?
So
Were we canceling anything?
we never canceled anything. I don't know how Dr. McDonald got on as the organizer of the district board meetings. But everything he had was kind of old. And so if he responded to that, then it kind of threw everything out of whack, long story short. So we're going to just clean that up.
So we weren't canceling the 14th meeting.
No, the 14th meeting will be on. You'll get a new invite for that, and then moving forward.
Okay, thank you. Any public comment? Being none, we stand adjourned. Thank you all for being here today and participating in this meeting.